The most outstanding Chinese medicine for cancer treatment, Professor Chen Hailin. Cancer is the main hidden danger that endangers human life. Although human research has more than 100 years of research history, countless scientists and medical scientists in the world have been fighting against it. They have been on a solid road, and there are almost no achievements. Understand cancer, conquer cancer, and destroy the mantra that humans cannot overcome cancer. Professor Chen Hailin has been the cause of cancer for decades. His personality is perseverance. As long as he recognizes things, no matter how difficult it is, he cannot shake his determination to complete his hard work. Based on this spirit, he wrote The Pursuit of the Motherland and Apo's drugs and eliminated people and Apo's disease with more than 40 years. Dao Chengyi, male, 83, professor, Chengji Institute of Mechanical and Electrical Engineering, Shaanxi Province. The patient was diagnosed with cardiac cancer in the year of nursing, and the condition was already in the late Qing dynasty. Due to cardiac cancer, she was admitted to Chengji People and Apo's Hospital in October 2009, after doing various examinations and improving the examination data. She was admitted to Chengji Urban Medical Center in November 2009 for radiotherapy and chemotherapy for more than 20 times. On February 16, 2012, she underwent imaging examination in Hejia Hospital, affiliated to Chengji Medical College, imaging opinion. After radialization of cardiac cancer, the current stenosis was obstructed. The cancer lesion expands and invades the fundus of the stomach, and the expansion of the stomach is limited. The doctor once persuaded the patient and Apo's family to give up treatment. One is that the patient is too old, all aspects of the body have problems. On the other hand, the patient and Apo's condition is too serious. Continue to treat the patient is also painful. Just at a loss, here next to the hospital bed to visit, the family said that there is a Chen old Chinese medicine, medical skills, the family holding a dead horse as a living horse doctor, and Apo's attitude to contact Professor Chen Hailin. Professor Chen Hailin has a set of observation, smell, inquire and cut the disease, prescribe medicine. The patient began to take Chinese medicine on March 12, 2012, and after nearly a year of complete cure, it has been 10 years. No recurrence, no transfer. The old man this year 93 years old, enjoy the old age. Wang Heping, male, 51 years old, esophageal cancer. Shaanxi Chen Yu Coal Chemical Group staff. First visit, December 2009. Chief complaint on September 19. The patient underwent surgery for esophageal and cardiac cancer on September 15, 2009, in the Department of Chinese Medical Science, Li Xiefeng College of Medicine, number 354169. Shortly after the operation, due to the existence of clear reason, and water did not enter the gastroscopy on November 9, 2009, Shaanxi Cancer Hospital, examination number 0097989. Examination and diagnosis, esophageal inflammation. The anastomosis was empty after operation, and the foreign body was removed under internal lock. 20 days after the operation, she went to the affiliated Heping Hospital of Chengji Medical College for examination on November 30, 2009 due to dysphagia and no TGE 00000648. Examination results: esophagogastric anastomotic mucosa hyperemia and stenosis, hydrodilation under endoscope. The internal ingot passed smoothly. Endoscopic analysis: after anastomotic stenosis and dilation, the hospital suggested that esophageal portal stent should be performed next time. On the morning of December 19, 2009, because of the difficulty of spring, the family called me to go to see a doctor. Body emaciation, pale face, throat medical difficulty, water does not enter, chest swelling pain, back slightly acid sleepy, insomnia, red tongue greasy, pulse fine number. Virus in the dialectical, chi drainage blood tight, body fluid loss, kicking and a green. The same day began medicine, swallowing extremely difficult, until dinner has passed, the tube has been unblocked, can high milk and rice soup, the second day afternoon into the semi-liquid food, a few months later from liquid food to general food, sway distending pain relief, back segment leisure. Gradually disappear. Now 10 months have passed, the patient and APO's symptoms are significantly reduced, and the use of double brake to learn self-driving technology, according to his own words, and quote, since December 19, 2009, has not cleared a holiday, did not enter a hospital inspection, did not take a Western medicine tablets. And quote. He is now in good health, and quote, winking sad smiley. September 25, 2010. On October 12, 2010, CT examination was performed in China Medical Science and Tumor Hospital. Case number 902345 was checked for good ventilation in the esophageal incomplete area. The disease was cleared at one time, and no recurrence or metastasis was observed in 13 years. During the Spring Festival follow-up, the mental state is very good. Everything is fine, wish him health and happiness. Middle esophagus, papilloma, Wujunjia, male, 53 years old, Shaanxi Tianji Group engineer. First visit, the 20th of August 1992. From January to March 1992, the patient had several episodes of sore throat, slow swallowing, foreign body, dry mouth, especially at night. On March 24, 1992, he went to the second affiliated hospital of Shaanxi Medical College for pathological examination. The examination results were middle esophagus, papillary pain. The hospital suggested surgery. The patient was afraid of surgery and transferred to traditional Chinese medicine, and took Chinese medicine in Taiyuan for 2 months. After being introduced to a hospital combining Chinese and Western medicine for more than 2 months, after stopping medicine for more than 20 days, his condition worsened, and he came to my hospital for treatment before August 20, 1992. At the time of seeing a doctor, the patient took the initiative to write down his current disease syndrome for reference in clinical diagnosis. Symptoms: thin body, difficulty swallowing, dry mouth, sternum pain, backache, sore throat, insomnia and fatigue, yellow tongue, thick and greasy, delicate pulse. Syndrome differentiation, phlegm stasis, chi stasis, body fluid deficit, accumulation of poison. Modern medicine believes that this disease is a benign tumor of the esophagus, accounting for about 2/3 of the benign tumors of the esophagus, easy to occur in the upper, middle and lower segments of the esophagus. 80% is single, there are multiple. Its clinical symptoms are mild, can have intermittent swallowing difficulties, chest and back pain. Western medicine is mainly surgical treatment. This disease belongs to the category of Chinese medicine and choking diaphragm and Its treatment can be compared with esophageal cancer and other chapters. Treatment: clearing heat and eliminating phlegm, regulating qi and dispersing, strengthening spleen and stomach, adding body fluid. After more than 4 months of careful treatment, the patient felt that the condition had been basically eliminated. In January 4, 1993, in Shanxi Provincial People and Apo's Hospital fibergastroscopy examination results: esophagitis, chronic superficial gastritis. There has been no recurrence of the disease in 22 years, and she was in good health during the follow-up in mid-March 2013. Patients with this disease have been cured for 30 years, 1x0, no recurrence, no metastasis. 2022 follow-up during the Spring Festival: good health, happy old age, I wish him health and longevity. Wang Qiusheng, male, 48 years old, Shaojiao Village, Chengguan Town, Lingchuan County, Shanxi Province. First visit, December 7, 2005. Chief complaint: the patient was hospitalized in Beijing Cancer Hospital for lung cancer 3 years ago, and his condition had been in a spike-solid state in the hospital. Suddenly, after lung cancer radiotherapy and chemotherapy on November 2, 2004, his condition worsened. The hospital adjusted the treatment plan according to his condition and increased drug intensity. In addition to conventional treatment, 1 case of Iressa and imported drugs was added every day for more than 5 months of continuous treatment. He was re-examined in the hospital on March 8, 2005, and his imaging opinion after chemotherapy for lung cancer was as follows: the right lung cancer was larger than before, lymph node metastasis was about the same as before, and the upper lobe of the right lung was abscess. No significant changes were observed. In addition to conventional treatment, the administration of the drug was increased, and a new tablet of Wedekai and imported drug was added every day. After 8 months of continuous administration, the patient was examined in the hospital on November 9, 2005, image number 11473. CT chest enhancement. Compared with chest CT on March 6, 2005. The mass of the right hilar of the lung was larger than before, now about 5 times 4 mm, the original 4 times 3 mm, not uniform enhancement. The extent of atelectasis is the same as before. Bronchial division: right main bronchus, right upper lobar bronchus, right upper lobar bronchus, middle segment of the official cavity, irregular stenosis, right upper lobar bronchus, opening part of the right upper lobar bronchus, uterus of the lung, right lower lung. Scattered piece flocculent lesions were similar before. Multiple nodules in the left lung were larger and more frequent than before, with a maximum of 45*36 mm, IMA 16, compared with 38*29 mm, IMA 18. The right lower lung is new, GUG, IMA 15. The enlarged lymph nodes in the mediastinum were similar to those before. Pleural fluid is the same as before. The localized density of the right posterior rib increased as before, IMA 29. Radiographic findings showed that the upper right lung cancer was more advanced than before. Multiple metastasis in both lungs was more advanced than before. On November 10, 2005, the patient called from Beijing, explained the reason, and decided to accept Chinese medicine. Regional drug treatment came for treatment before December 7, 2005. Syndrome: thin body, dark yellow face, chest tightness, shortness of breath, back pain, bilateral subclavian bone. 2 armpits: there are multiple lymphatic nodules, hands numb, anorexia, fatigue, dry mouth, tongue margin red, fur thick. 2 sublingual varicose veins, deep pulse. Syndrome: differentiation, deficiency of qi and yin, deficiency of body fluid, accumulation of toxic accumulation. Treatment: clearing heat and detoxifying, preserving jin and nourishing yin, dispersing jihua. Investigation: stop all drugs during Chinese medicine to avoid mixing. After more than 60 days of taking 30 pairs of Chinese medicine to treat pain, the patient and APO's self-symptoms improved, and the patient was examined in Beijing Cancer Hospital on February 23, 2006. Imaging findings: chest comparison with November 9, 2005. The mass of the right hilar of lung was reduced to 39*30 mm, IMA 30, compared with 52*4 mm, IMA 30. The central solid part is about 11 by 9 mm, IMA 7, originally 45*36 mm, IMA 16, now the maximum is about 13 by 10 mm, IMA 28, originally 24 by 17 mm. The right lower lung nodule was not shown on this scan. The enlarged lymph nodes in the mediastinum and around the trachea and in the left hilus of the lung were smaller than before, and now the maximum is about 15. Wu Huan Miao, female, 64 years old, Department of Shaanxi, Luqing City Shop, Shangwangjiabu Village, in April 1999 in Chengde and Rate Hospital. Microstomach examination, esophageal cancer, after surgery in Henan Linju Cancer Hospital. After surgery has been in liquid food and hospital treatment, but the high hospital fees and surgery fees make this not rich family worse. Patients and their families cannot afford the cost of the hospital, chose to discharge. At a loss, I was introduced to Professor Chen Hailin. The patient came to the treatment in mid-September 1999 after more than 5 months of treatment, one-time cure so far 21 years, no recurrence and metastasis. She was followed up on May 2, 2019 and is currently in good health. So far no recurrence, metastasis, one-time lifetime farewell to medicine. In the difficult years, Chen Hailin experienced too much. In a summary, 90-9 sweat, a point inspiration, more than 40 years of realization. Professor Chen Hailin has developed thinking and imagination of thinking and imagination from multi-layer, multi-system, multi-directional, multi-dimensional roads and multi-channel thinking. Based on the combination of traditional culture and quote, transformation books and quote, the combination of and quote, 5 elements and quote, and Qigong, Yang and Yang, and nourishing disciplines. Under the guidance of traditional Chinese medicine, the three-focus gas theory is organically combined with the diagnosis of modern medicine and image data. Perform symptoms of drugs, perform gasification intervention in the internal and gaseous centers, spleen and stomach, for gas exchange mechanism to enter and exit the lesion, quickly curb the diffusion and metastasis of cancer cells and directly destroy mutations of mutant cancer mutations. Cancer cell repair lacks mutations, and cells and cytoplasm cells make cancer cells reverse to normal physiological cells. Theoretical foundation, and quote, Tianyuanji Da and quote, describes, and quote, it is the gas in heaven, the ground is shape, and the shape of evaporation will be made from all things. And quote, the principles, pathological phenomena, disease diagnosis, treatment and prevention principles, so as to quickly achieve the purpose of cure tumors through gasification evolution. A comprehensive cancer treatment plan has been formulated with unique Chinese medicine characteristics and innovative thinking.